The next type of tumor I'm going to talk about is inflammatory, and this involves the skin of the breast. What the patient is going to describe to you is pain, and you're going to see some swelling, some redness, and we call this pudding orange because it makes the skin of the breast thick and kind of dimply like the skin of an orange peel. And this has a poor prognosis because what this does is it directly invades the lymph nodes of the skin of the breast. The last kind I'm going to talk about is Paget's disease, and this involves the nipple or the areola. You'll probably see dry, flaky, itchy skin. We call this eczema-like, and you'll see ulcerations. And what Paget's disease is a sign of is underlying breast cancer. The Paget cells are characteristically large cells with a large clear nuclei, and the cells also have a halo around them.
Okay, now we've just covered malignant and benign conditions, but the most common breast conditions are your fibrocystic disease type of conditions. This is where you find more tissue, connective tissue, than fat itself, and it shows up mostly in your fertile years from ages 20. This is a fibrotic condition where there's more of connective tissue, ligaments, scars than the prominent fatty tissue. The tissue feels firm, rubbery, and even hard. It's generally the hyperplasia of the breast stroma, and it does not increase a risk of breast cancer. Next, you have your cystic type of fibrocystic disease, which these are fluid-filled cysts that can be found in the breast. They are round, oval, and smooth, but they're not bumpy. If it's tender and it's movable, then it's a cyst. It will show up on a mammogram or ultrasound, and if the diagnosis is not definitive, then you can actually do a needle biopsy to actually confirm the diagnosis, fluid out of the cyst. Next, you have a sclerosing type of fibrocystic disease, where this is excessive growth of tissue in the lobules. The histology is increased ascending intralobular fibrosis, and generally on a mammogram it shows up as calcification. You have epithelial hyperplasia, which is increase in number of epithelial cells in the terminal duct lobule. This type of fibrocystic disease generally is rated as florid, moderate, or mild. The florid type of epithelial hyperplasia generally shows up with atypical cells, and it has an increased risk of carcinoma. It also is predominant in ladies greater than 30 years of age. Some other common breast conditions: you have acute mastitis. It's an inflammation of the breast in connection with pregnancy, post-pregnancy, and also when the child is being weaned off of the breast. It's breast abscesses formed during breastfeeding. It's generally the organism is transferred from the child's mouth to the cracks of the nipple of the mother, and that's how it causes an inflammation. And S. Staph aureus is the most common pathogen. They generally treat it with dicloxacillin. Fat necrosis, it's a benign condition. It's painless lumps, and they're found generally in women that have large breasts. And it can be due to some sort of trauma, a lumpectomy where they've taken a biopsy, or after radiation. And these lumps are not, they do not increase the risk of cancer.
Some of the risk factors for breast cancer. The biggest risk factor you want to worry about is the BRCA1 and BRCA2 gene mutation. This increases the relative risk to about 15. And the same goes for a ductal or lobular carcinoma in situ. Now, some other risk factors are going to be, of course, female sex. Only about 1% of breast cancers occur in men. Women over the age of 40 are at higher risk, and also anything that relates to the number of menses or cycles they've had in their life, such as early age of menarche around age 12 or before age 12, late menopause after age 55, nulliparity, or delaying childbearing years until past the age of 30. Also, if they have a primary relative with breast cancer at a young age, then that's a strong indicator. One important note to always not forget is that fibroadenoma and non-hyperplastic cysts do not increase the risk of breast cancer. So, So to sum up, as in finding a breast lump or a mass is always going to be a frightening experience for a lot of women. However, most of these tumors will actually be benign. Some of the more common is going to be the fibroadenoma, or maybe just a fibrocystic change of the breast. But of course, if it is malignant, then one of the ones you always want to worry about is non-invasive ductal carcinoma in situ. And that concludes the presentation on breast disorders. Thank you.